My name is Lawana Russell. I'm one of the co-chairs for this great event today. And
my name is Angel Jacobs, and as she said, I'm one of the co-chairs for our Health and Human Services facet for the Links Incorporated.
So the Links Incorporated is a national organization, and across the country and in two other places in the world, we have all types of facets that focus on community activities. And our Health and Human Services facet is one of those where we are focusing on health in the community.
Yes, and today is the National Impact Day of Service, so we're having Black Family Wellness Expos across the country today, again, to try to intervene in some of the health disparities that exist within communities and to make sure that people have the information and resources that they need. Yes, well, because communities they suffer from different levels of knowledge and access, quite frankly, and so we want to make sure that we can help provide information that will help people turn around some of the root causes that create unhealth or dishealth in the communities. And so by having these screenings and having this information, helping people understand what's important, we hope to be able to change that tide.
And I would just add on to that, understanding for yourself, right? Because sometimes you can go to a doctor and they'll push you off or tell you, oh, it's fine, oh, you're this, and then you'll find out later that it's something more. And I'll actually give you a personal story on that in terms of understand and paying attention to your own health. My daughter in 22, I believe, maybe 23, she was diagnosed with MS. And it's only because she was diligent. She was in her junior year of college, and she had something going on with her eye. And she went to a doctor that said, oh, you just have a lazy eye. If my daughter had not pushed forward, if she didn't understand how to advocate for her health and understand the fullness of her health, she might not be walking today. Because by the time she went to the fourth doctor that sent her to get an MRI, she had lesions all over her brain and 4 in her spine. And we caught it, and now she would come in here and dance up the storm with everybody else. So it's really, really important to be an advocate for your health.
Hi, I'm Kirti, and I'm an RA, a research assistant at the iCharm lab. I'm a public health major on the BSM-PH track at GW, and I'm also pre-med. I've been part of the lab since May of 2024. What inspired me to join iCharm, I really like how we do a lot of work with the community, and I think it's very helpful to educate people on different health topics, and the iCharm lab does a lot of that. What kind of work do I do at iCharm? I go to a lot of health fairs, as well as helping out with the study, sending out test kits and things like that, communicating with participants, and just in general, helping disseminate health information. My favorite part in working here is working with everyone in the lab, and of course, Dr. Lei, she's such a great PI. And everybody I've met here, they're all super fun and nice and good coworkers. What do I like about going to community events? Again, I really like helping out in the community. We get to meet a lot of new people. So much as we're helping people learn about health information, we're learning just as much from the other vendors that are here as well. So it's just an overall great experience. Why is cancer awareness and prevention important to me? It's important because, again, like a big thing in our lab is educating people on cancer awareness, and the first step in preventing cancer is to know about cancer and to know what your options are, getting screened, things like that. So that's why cancer awareness is important to me, because we're educating people and helping them protect themselves. So I think our research helps us find events tailored to a specific community. The most important thing to know is to get screened and get screened early. How would I describe the lab's culture? I think that we're a very supportive group of people, very educated and smart people who also are very kind and know a lot of things, and I learn a lot from them. I think it's a very kind and supportive place to be at. What is your name and position?
My name is Tausif. I am a volunteer with the research lab.
What is your educational and professional background?
Yeah, so I graduated from University of Maryland, College Park, May 2024 with my bachelor's in biological sciences. For the past 2 years, I've been I worked as a full-time medical assistant at an ENT, ear, nose, and throat practice. In 2 months, I'll be starting PA school here at GW.
How long have you been with iCharm?
I've been with iCharm since fall 2023, so the fall semester of my senior year. So a little over 2 years. So it doesn't even feel like it, but basically.
What inspired you to join iCharm?
I wanted to get involved with iCharm to learn more about how we can implement community health interventions to help marginalized communities overcome these systemic barriers to inclusive and equitable healthcare. And I also wanted to see how community health intersects with our healthcare system and patient care, and how I can implement these strategies into my patient care as a future PA.
Explain what kind of work you do at iCharm.
Yeah, so when I first started in the lab, I was a research assistant. So I did a project using data from our Digicom study, and I presented at 2 conferences. But now I've been volunteering. I switched more to like a volunteering position. So I work with the lab to come out to these events, these community health events. I help with running our booths, running our tables, reaching out to the community, assisting with recruiting participants for our HVB self-sampling study. And I also help with offering like screening, like blood pressure screening, blood glucose screening, HIV testing as kind of an incentive to get people to come to us and possibly join our study. My favorite part about working with the lab, this sounds so cliche, but the people, you know, like the community and the vibe and the environment that we've created, it's super collaborative, super friendly, very warm and welcoming environment. I think Dr. Lay and the rest of the lab has done a very good job in cultivating that sort of like healthy team environment and culture.
And then what do you like about going to community events?
What I love most about coming out to these community health events is honestly just branching out more into like the DMV area. I grew up in this area, up in Maryland, Montgomery County, and so it's really interesting to go to these different parts of DC, different parts of Prince George's County, Northern Virginia, just being able to like physically interact with these different communities, different organizations, and yeah, just seeing everyone like supporting one another and helping to like enrich our community.
Why is cancer prevention and awareness important to you?
Yeah, it's super important because cancer is one of the leading causes of death, not just in the US, but around the world. It's a very serious illness. Unfortunately, it's lots of areas of cancer treatment are still very under-researched and underrepresented. So it's very important to reach out to these communities and kind of equip them with the tools, the knowledge, and the resources they need to help lower their risk of developing cancer and of just developing chronic illness in general. Yeah, it's just, again, helping to educate the communities with the knowledge that they might not get elsewhere. Just coming out to these communities, it like influences my perspective because, if you don't interact with these communities and kind of just blindly conduct research based on, oh yes, literature is important, but it's also important to see what it's actually like out in the community. Just seeing these interventions and this research kind of come to life and seeing how our interventions and how our research actually manifests in the communities, that can help better inform like how we guide our research moving forward. And super friendly, super supportive. Everyone is always there for each other. We're always supporting one another. We always, lend a helping hand. It's really easy to approach everyone in the lab, Dr. Lay, the other research assistants and volunteers, and that just motivates me more to get more involved in community health research and community health outreach. I think the most important message about cancer prevention for people to know is that it's important to be proactive about cancer prevention, and that people should know that they're not alone. There are a plethora of resources out there in their local communities, like for food, for diet and nutrition, for physical activity, for mental emotional support, for social support. There's all kinds of resources out there in the community that are accessible, that are local. And so I think it's really important to take advantage of these opportunities and these resources to take control of your own health and live the best quality of life.
Hi, my name is Jordan Simmons. I am from Alexandria Housing Development. We came and brought some of our seniors here, so we are, we just wanted to show them the event, that's all. Well, I was really interested about how they did the testing for like the cancers and of course, all your blood pressure and things like that. I have a very high history of that in my family, so I just wanted to make sure I was, aware with my status and the things like that, so.
Sean, and what brings me to the Expo is that I've taken a greater interest this year on my health and making sure that I continue to stay as healthy as possible. And so I thought maybe this would help me in that journey. And I stopped over at this table because GW is indeed the facility in which I go to most and many of my things. So I wanted to see what you guys were offering today. And I see you're giving blood pressure checks. So I am excited to make sure my blood pressure is where it's supposed to be today. So I'm in line and I'm next. So that's what's bringing me here today. And I'm interested in all the literature. So I want to see what you got to say about colon cancer, I see, and other cancer screening. So I'm hoping to pick up some information and learn additional things.
My name is Tamika Tunsil, and I am the president of the Arlington, Virginia chapter of the Links Incorporated that is hosting this expo today. And we are hoping that attendees just got out of it everything that they were expecting. The screenings, a lot of different screenings going on today, including blood work. So people are walking away with appointments with primary care, getting their blood pressure checked, their glucose, other resources in the community, including food bank information about cancer research and preventative measures, even a virtual experience today that people are experiencing. So they're walking away, the kids included, with a lot of wealth of information. We, as an organization, are fully aware of the health disparities, resources available, and access to resources especially. We even had someone here that was enrolling individuals who are uninsured and helping them navigate the Medicaid, Medicare process. So that's another resource. And we're aware of the lack of resources in the community and those organizations that are trying to address that, not just us, but those who are here today partnering with us. We just want to give them a space where people can come, one-stop shop, and connect with you all and get the resources that you have available as well. So that was what is important. We know that people are in need. There's a growing health crisis, and they just don't have access to the information. So we figured one-stop shop, come and get everything you need and walk away with resource information and make those connections. This is actually a national day of service for us. So there are chapters across the nation that are holding this expo today. We decided that we wanted to expand on it, have it at a local community center, invite more vendors this year. And that was really it, to be more impactful in the community. But it's a national initiative, so we were going to make sure this happened one way or the other. Absolutely. This is our 4th event. There was one that we had to do virtual, but we made sure that we could stay connected with our community partners. And we are absolutely already planning for next year. We were looking at logistics today. So we are, yes, and yes. We are planning for next year. So I hope you join us.
Hi, my name is Victoria Jackson Awe. I'm from Health Development Initiatives. So we are here to do cholesterol, A1C, and CMP. So we check for the liver and kidney functions, and we are doing hepatitis B, which those are the things we are doing. I'm the clinical manager for the HKI. Been with HKI for like 7 years, and these are we do free school, everybody is free. It's no charge. We do your blood work, you send it to lab, and then within a week, you get your result. If you give us email, as soon as you get it from lab in 2-3 days, you get it the same day. If you don't want to send it to your email, so we will mail it to you. So it depends on the, post, how it gets to you for post office. This is actually nice, we enjoy it. So, you guys have a lot of breaks in and out, but overall, it was actually nice. Oh, Dr. Lee, we always around for different events. As a matter of fact, I'm inviting it to we have a program called My Healthy Step. So what we do bloods. We want for healthy living, for nutrition. So we're doing that on the 18th. It's going to be in Maryland, actually in Clinton. So we're going to do blood work. We're going to do exercise, going to be dancing, and I'm inviting her. She can come and do a nutrition class for us. Okay.
One of the main things we want attendees to take away is that a lot of people just say, get up and exercise, and that's healthy, or eat well, and that's healthy. But health is mental, it's financial, it covers everything. And so we want our attendees to really understand what the fullness of health means and why it is important and how we can help support.
Yes, and so as my Link sister said, we want to make sure they have the information, the resources, and the knowledge to make better choices going forward for themselves and for their families.